Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I'm Gregory Turnbull, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Special Public Board meeting. Thank you for taking the time to join us. This is a special meeting of the Board to consider 4 motions. To start, in the spirit of promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Commission, on behalf of the Board, I would like to take this opportunity to acknowledge that the work of Alberta Health Services takes place on the historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would also like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples who form an important part of our healthcare system. We are grateful to those who have come before us and mindful of those who will follow us as we steward and protect these lands. Before we get to the business of the day, I'd like to offer my deep gratitude and respect for healthcare workers across our province. They're continuing to work long and difficult hours to support the province through another wave of COVID-19. In particular, our people on the front lines are now caring for an unprecedented number of Albertans in our hospitals. This is difficult work. It takes a physical and emotional toll. After almost 2 years of pandemic, our frontline workers are understandably tired, and yet they continue to provide quality, compassionate care under ever-changing circumstances. I want to acknowledge their efforts and sacrifice and offer them my deepest appreciation and respect. Thank you. And now to you, Roberta.
Great. Thanks very much, Greg. I know that our physicians and staff and volunteers will really appreciate your comments, so thank you for that. I also want to express my gratitude for everything that our people are doing every day, whether they're delivering care or supporting the delivery of care, whether they're directly dealing with the demands of COVID-19 or the demands and challenges that the pandemic has placed on other parts of the healthcare system. I see that our people are consistently rising to the challenges. I see them caring for Albertans. I see them supporting one another. I see them continuing to approach their work with professionalism and compassion. And that inspires me, as well as our entire executive and senior leadership team, to do our very best for them. And of course, people can't be strong all the time. We need to care for ourselves and do what we need to do to protect our own physical and mental wellness. There are many supports available, easily accessible 24/7 for AHS staff and physicians, and I'm pleased to see that our people are accessing these supports to help themselves, their colleagues, and their loved ones through the pandemic. But I'd also like to point out that AHS offers many free mental health tools and resources for all Albertans. They can be accessed through our webpage, www.ahs.ca/help-in-tough-times. There, Albertans can access a mental health helpline and addiction helpline, or sign up for support such as Text for Hope, which provides daily text messages of encouragement, and Together All, an online network that offers anonymous, peer-to-peer mental health services. There are many more supports available through the Help in Tough Times webpage, so I encourage Albertans to visit if they are looking for assistance to getting through this stressful time. And we will get through this pandemic together. So thank you for your time, and back over to you, Greg.
Roberta, thank you for your comments. We are participating by teleconference today. When I ask for a vote on the motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take that you are in favor of the motion. If there are none, or a minority, who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
It's Hartley Harris. I so move.
Thank you, Hartley. Will someone second the motion?
It's Sherry Fountain. I so second the motion.
Thank you, Sherry. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. I ask Saye Zelke, Vice Chair of the Human Resources Committee, to present the first motion for approval.
Thank you, Mr. Chair. The Board has considered the mediator's recommended terms of settlement for the AHS-UNA Direct Nursing Collective Agreement issued on December 21, 2021. The Board reviewed the proposed terms of settlement to ratify such recommendations. The members support the ratification. Accordingly, I move that the Alberta Health Services Board ratify the mediator's recommended terms for settlement for the AHS-UNA Direct Nursing Collective Agreement issued on December 21, 2021. Thank you.
Thank you, Saye. Will someone second the motion?
Natalia Ryman. I so second.
Thank you, Natalia. Any further discussion? Any opposed or abstentions? I declare the motion is carried. I now ask Brian Vasjo, Chair of the Finance Committee, to present the motions arising from that committee.
The
Brian.
Finance Committee met on January 27th, 2022. I'm presenting three motions for board approval today. First, the committee reviewed terms and conditions with DynaLife DX for delivery of provincial community laboratory services. The committee recommended board approval of the same. The board reviewed the terms and conditions, and the members support the approval. Accordingly, I move that Alberta Health Services Board A, approve Alberta Health Services entering into the term sheet for the provision of community laboratory services between Alberta Health Services, Alberta Precision Laboratories Limited, and DynaLife DX. B, on behalf of Alberta Health Services as sole shareholder of Alberta Precision Laboratories Limited, approve Alberta Precision Laboratories Limited entering into the term sheet. On the terms and conditions reviewed by the Finance Committee and the Alberta Health Services Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. 2, delegate the authority to the Alberta Health Services President and CEO to execute the term sheet on behalf of Alberta Health Services and Alberta Precision Laboratories Limited in accordance with the delegation of authority and establishment of controls for commitments policy. And 3, delegate the authority to the Alberta Health Services President and CEO to execute the Community Laboratory Services Agreement on behalf of Alberta Health Services and Alberta Precision Laboratories Limited in accordance with the delegation of authority and establishment of controls for commitments policy, provided the final fundamental terms and conditions of the services agreement are not substantially different from the executed term sheet.
Thank you, Brian. Will someone second the motion?
Mr. Chair, it's Deborah Apps. I so second that motion.
Thank you, Deborah. Any further discussion? Any opposed or abstentions? The motion is carried. Brian, you have a second motion.
Second, the committee reviewed amendments to the COVID-19 interim authorization to spend and recommended board approval. The board reviewed the authorization and the members support the approval. Accordingly, I move that the Alberta Health Services Board approve amendments to the authorization to spend related to costs for the COVID-19 pandemic response previously approved by the Alberta Health Services Board on November 25th, 2021 as follows. 1. The interim authorization period under the COVID authorization to spend be extended to end on March 31, 2022 rather than January 31st, 2022. 2. The maximum expenses under the COVID authorization to spend be increased from $1,112,000,000 to $1,539,000,000 for the extended period April 1, 2021 to March 31, 2022. And 3, the maximum capital expenditures under the COVID authorization to spend remain at $28 million for the extended period April 1, 2021 to March 31, 2022.
Thank you, Brian. Will someone second the motion?
Mr. Chair, it's Sherry Fountain. I will second the motion.
Thank you, Sherry. Any further discussion? Any opposed or abstentions? The motion is carried. Brian, you have a third motion.
Finally, the committee reviewed a one-year contract extension with Sodexo Canada Limited and recommended same for board approval. Board approval is required in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. The board reviewed the recommendation and the members support the approval. Accordingly, I move that the Alberta Health Services Board 1. Approve an amendment to the contract between Alberta Health Services and Sodexo Canada Limited for housekeeping services in acute AHS facilities in Calgary and South Zones to provide for a one-year extension commencing April 1, 2022 on the terms and conditions reviewed by the Finance Committee and the Alberta Health Services Board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and 2, delegate to the Alberta Health Services President and Chief Executive Officer the authority to execute documentation to effect such amendment referred to above on behalf of Alberta Health Services in accordance with the Delegation of Authority and Establishment of Controls for Commitments policy.
Thank you, Brian. Will someone second the motion?
Mr. Chair, this is Vicki Yellowold Woman. I will second the motion.
Thank you, Vicki. Any further discussion? Any opposed or abstentions? The motion is carried. Before we close, I'd like to express gratitude to the Alberta Health Services and United Nurses of Alberta negotiating teams who worked tirelessly over the past several months to reach the new 4-year collective agreement. We know more than 30,000 registered nurses and registered psychiatric nurses play a critical role in our healthcare system and our pandemic response. My hope is this agreement provides them some positivity and stability at a time when they need it most. We have reached the end of our agenda. I now declare the business meeting adjourned. Thank you for joining us, and please be safe and well. Thank you for attending.
Together, we do amazing things every day.